Hello, we're rolling into another episode of the DRH show. As usual, in each episode, I'll be talking to interesting people within psychology, mental health, and well-being. Today, I'll be talking to a psychologist from Dubai, Dr. Kirin Hilliar. Thanks for joining me.
Thanks for having me, Dennis. It's a pleasure to be here.
Okay. It's great to have you here, Dr. Hilliar, but let's start off with you telling us your background, your trajectory in life, and how you ended up working as a psychologist in Dubai.
Sure. So I'm from Australia originally, and that's where I did my psychology studies. So I did my Bachelor of Psychology at the University of New South Wales, and then went straight into my postgraduate study. UNSW is a bit unique in that it offers the ability to do both a master's degree and a PhD at the same time. So my original plan had just been to do a master's in forensic psychology, but I really enjoyed that research process whilst doing my honours thesis. And my honours supervisor had told me by the end of the year, I'll have convinced you to do your PhD. And I was like, whatever. And he had by the end of it. So I then stayed at the university for another 4 years. And did my master's and my PhD, because in Australia it's a little bit different to some other countries where a PhD is pure research, so there's no coursework or anything, and a master's is where you do your coursework and your internships and a thesis, so combining the two is possible. And then once I finished, I started work with Corrective Services New South Wales. New South Wales is my home state. So I worked in a maximum security prison in the Serious Offenders Assessment Unit, which is doing assessments of serious offenders. So the title kind of describes everything. And then after some time there, I then transitioned to New South Wales Health. And we have a forensic hospital, high security forensic hospital. So this is for people who are found not guilty by reason of mental illness, or these are people who are in custody in prison and then become mentally unwell. So they might get transitioned over to the forensic hospital, and then if they get better, they're transitioned back to the prison. Or you'll have people who were never in prison because they were found not guilty due to their mental illness, but then they're classed as a forensic patient, so they have to undergo some form of mandatory treatment. And then at that point, I was looking into moving to Dubai for various reasons, so I started searching online, and forensic psychology is a very new area, very much in its infancy here. So trying to find a forensic psych specific job was proving to be quite challenging. And then through a combination of pure luck on my part, an opportunity came up to work in a government entity here doing occupational psychological assessments. So working in an assessment centre and doing these full day assessments of people that different government entities were considering either hiring or doing development plans for current employees, or doing skills auditing of an entire entity. And that was really good. That was really interesting, going into a very different area of psychology and what I had been trained in, and getting exposure to how government works in another country. But after some time there, I thought, I'd really like to advocate more for forensic psychology here. I think there's a lot of scope and opportunity for us to be doing some really important work here. And if I'm going to do that, I need to put myself out there a bit more. So I started looking for another job that would allow me to do that, and started working in a private mental health clinic, LifeWorks. And then again, very fortuitously, an opportunity came up in academia, and I now work full-time at Heriot-Watt University's Dubai campus as an assistant professor of psychology. I do that full-time, and I still work part-time in private practice. So I was at LifeWorks. Now I'm at another private clinic here in Dubai, Open Minds. And I'm really enjoying that mix of different job responsibilities. So my career has kind of gone all over the place,
Yeah,
which I've
non-linear.
enjoyed. Yeah.
Yeah. Thank you for giving us a snapshot of your career, of your trajectory in life. You already briefly mentioned about this, that your background is in forensic psychology, but if you could just expand more on what exactly is forensic psychology, what is it for? What are the aims of these disciplines?
Sure. And I think that's good to clarify, because a lot of people, I don't think they've got a good understanding of what it actually encapsulates. And sometimes people get it confused with forensic science, like crime scene investigation work, which is not what we do. So the term forensic refers to the law. So forensic psychology is the application of psychological theory, principles, and practice to the legal system. So whilst quite a lot of our work can be in the criminal justice system, you also will see forensic psychologists working in civil law, family courts, workers' rights, drug and alcohol, you name it. So what I really like about it is you're taking different elements of psychology, so social psychology, cognitive psychology, developmental, biopsychology and neuroscience, political psychology, perceptual psychology, all of these different areas of research, and then looking at their real world implications in the context of the legal system.
But your career hasn't been exclusive to forensic psychology, right?
Right, yeah. So I think that was my original plan when I started. I love forensic psychology. I'm very passionate about that work. But yeah, my career has kind of moved across forensic and then occupational psychology and then clinical, and now I'm in academic work as well, which I think is nice in that it demonstrates the generalizable skills that we learn in psychology. And it's something that I do stress to my students because, you know, if they're doing their bachelor's degree, they're looking into their master's programs and further studies. And I'm telling them that this isn't a life, I don't want to say a life sentence, but this choice that you're making won't define the rest of your career if you don't want it to. So it's leaving yourself open to opportunities as they present themselves. And we learn a lot of really generalizable skills. Psychologists are really good at critical thinking and analysis and multiple perspective taking. Our written and verbal communication skills are very good, and we understand the principles of the scientific method. So we're often in quite high demand by employers because of those different skill sets that we've got.
You mentioned that because of your background in forensic psychology, you would acquire different skill sets. But do you think that, we're experiencing lockdown at the moment, so do you think that it has cast a different light? Basically, what I'm asking is, do you think issues, relating to forensic psychology is relevant in the era of COVID-19?
Oh, definitely, yeah. I think the one that comes to mind first for me is this well-documented increase that we're seeing in domestic violence and family violence. And we're seeing that globally when it comes to how people are coping with these stay-at-home orders in our efforts to curtail COVID-19. So you want to minimize people's movements to try and optimize your ability to contain this virus. But then that in and of itself is creating quite a combustible situation for people at home. People who are already experiencing some tension in the family unit, now you're stuck in a confined space. Your ability to just get out and minimize your exposure to each other and seek out other ways to kind of de-stress is now limited to you. Families are exposed to potentially higher levels of financial stress. All of these things then mean that you've got people who are already experiencing difficulties in regards to how their relationships are going, and now we're seeing more incidents of domestic violence and family violence. And you're also creating a situation where for families where maybe this wasn't an issue for them before, but now they're being exposed to such stresses and a minimized access to other ways of coping, that now this might start to become a problem for them. And I think governments didn't anticipate how significant that increase was going to be, despite warnings from domestic violence and family violence experts that this is probably going to happen. So they responded a bit late, but they are trying to cope with that as best as they can. So that's kind of the main area that I see sort of jumping out. But I think another one is things like, how do you get people to abide by stay-at-home orders? How do you communicate why they're needed, and how do you enforce that in order, if your goal is to get people to actually comply with that? So that brings up this question of, why do we follow laws? Do we follow it because we're worried about getting punished? So is it, okay, if you enforce fines for people, then that would be sufficient. That'll force people to comply, and that's the end of the problem? Or are there other factors that play into that as well? And then there's issues like governments are rolling out different financial support packages, which is great. But how do you do that in a way that, for example, minimizes fraud in people's applications? So do you have people, for example, who are misrepresenting how much their business was earning because they think that will get them a higher loan? Do you have the right sort of criteria, and is that criteria clearly set out so that you're actually able to target the businesses that need this support? Or are you going to have situations where these larger companies that aren't under as much pressure are accessing these schemes and these loans faster because they have all these processes in place that allow them to just submit an application as soon as possible? So I think those are the three that I've seen most relevant and most interesting to see how that plays out, and seeing governments responding and reacting to, here's an initial plan that they have and they roll it out, and then they realize, oh, here's a problem that maybe we didn't anticipate, and how do we then respond to that and modify things? So yeah, I think forensic psych is still very relevant given everything else that we've got going on.
Now, since you already mentioned that the lockdown has been disruptive and stressful for families, so what advice would you say to these families?
Families, yeah, and I guess different families look different. But I guess the main thing that I would stress to families is that this is not a normal situation that you're going through. So you shouldn't expect yourself or other people in your family to function or to be as productive as they would be under like normal circumstances. I mean, I have to say I have huge respect for parents who are now homeschooling their children. For some of them, they're also going to be working. For some of them, they were a stay-at-home parent anyway. But there's a big difference between your parent-child relationship and then trying to take on the role of a teacher. That creates a completely different set of dynamics. And a parent has not been trained to do this. Now, yes, you might have parents who are already homeschooling. That's a fairly small proportion of the population, but they're still there. But even for them, it might be that their usual outlets and ways of educating their kids, they just don't have those facilities available to them. They can't go outside, for example, and explore the world or things like that. And you might have parents who are teachers, but still teaching your child is very different to teaching other parents' kids. And I guess with schools as well, they're coping with this as best as they can, but the schools are also dealing with a very unique situation that they haven't dealt with either. So in terms of them trying to develop these distance learning programs, they're trying to do that based on the research that they've got, but they haven't dealt with a sort of situation like this before. So they're making the best estimates that they can around how this could be working, but that's not going to work for every family. I have quite a few clients where it's their parents, and they're putting a lot of pressure on themselves around, oh, like I have to try and fit in 2 hours, 4 hours, 6 hours of my kids' schooling, and then try and find time to work or to do everything else that I need to do. And it's been talking with them around, this is, you should be aiming for the best that you can do at this point. And if that means it's only 30 minutes in the morning, that's fine. Kids are not going to remember how much they learned during this experience. They're going to remember how they felt, and what kind of the emotional environment was for them at home. So it's that what you're doing is good enough, given everything that's going on. You're dealing with a very unique, stressful situation. This is not normal, and it's okay to just do what you can do.
Mm-hmm. And what about for single people? Because we would expect it to, present a different set of challenges for them. So what would you tell them?
Yeah. I think, and again, different people are going to respond differently to this situation, given their own personality and everything else. But we're an inherently social species. We largely operate in tribes. Evolutionarily, we have evolved where we function optimally when we're in groups. And now you've got this situation where people could be living alone, and that could be by choice. But they're also now no longer having those incidental interactions that they had with people before. So that amount of just social exposure has gone down because there's no one else in their physical space. Trying to optimize Zoom meetings and everything is good. Zoom and online chats create their own sort of unique challenges, and they're certainly not an exact replication of what it's like to actually sit with someone else directly in front of you. So there's that. They're no longer socializing to the same level as they probably were before. And also, if you are single, they tend to live in smaller spaces. And so then you just don't have that physical capacity to move around as much. And there's also some research regarding self-complexity theory, how you have different aspects of your identity and these, I guess, context-dependent social roles and relationships and activities, everything we do. And so we get used to, when I am a worker, when I do my work, I'm at this space and I'm with these people and I do these things. And then when I'm the partner or a spouse, then I'm in this space and I do this thing. And then when I am engaging in my hobbies, I'm at this new space and I'm doing these activities. And you don't have that now. All of these aspects are reduced. We're trying to do everything in a smaller space. And that can make us more vulnerable to experiencing negative feelings. And I think that can be compounded for single people when they're just in a significantly smaller space. But this can come up with with families as well, when you have multiple people in a smaller space and just trying to access things like privacy and your own ability to disconnect and get that personal space. So yeah, I think for single people, those are the types of challenges that they're facing at the moment.
Now, those are really useful advice. Now, let's move on from COVID-19 in relation to mental health and well-being to another topic. Let's talk about how, because I think this is another aspect of what you do. You're trying to help people achieve a more positive mindset. So in general terms, can you give us some simple solutions for people to clear their heads and to achieve a more positive mindset?
Sure. So I guess there's 3 exercises that I can think of to try and help shift people into that more positive mindset when they're dealing with a lot of stress. So there's one exercise where we will talk about, there's a situation that someone is dealing with, and it's defining, well, what's within your domain of control in everything that's going on. what is it that you can control and what's the stuff that you can't. Once we then identify that, so let's say someone's facing stress at work, and it's identifying, well, what is in your control? Okay, I'm able to kind of set the hours that I choose to work. That might be in control for one person, but that same thing might not be in the control of somebody else. It might be, no, our work is expecting us to put in a certain number of hours to achieve this project deadline. And the only way to do that is if I'm working 14 hours a day. So it's, these things are going to be different for different people, but it's identifying what's in your control. And if this is within your control, then we go to a more solution-focused strategies around, okay, if this is within your control, then do you feel like you are managing this to the best level that you can? Or is there anything we can be doing to facilitate that? Is there information that's missing that you think you need to get? Or are there skills that you would like to develop for yourself? Or is there a conversation you need to have with someone in order to more clearly set out responsibilities or things like that? So that's the stuff that's within your control. And then there's what's outside of my control. And if this is outside of my control, no matter how amazing I am, that's really not going to have much of an impact on what the decisions or the consequences of this. Then how can I best allow myself to cope with that? So an example might be that someone might just not get along with their boss. That person has a particular personality style and they just kind of conflict with each other a bit. And then it's, okay, well then if that's the case, what do you think is your best strategy for helping you cope with that? And for some people, it might be, maybe I need to minimize my amount of face-to-face interactions with this person. And if we need to chat, then we'll do that through email. And so for them, actually working from home could actually work really well, because they're able to they then suddenly have a lot more control over how much interactions they need to have with this person. So that I find is a helpful exercise for people to do. Another one which kind of targets the same thing, but from a slightly different perspective, and this often helps with people who have a quite perfectionistic traits or feel a sense of guilt a lot of the time, is what I call a responsibility pie. So in the responsibility pie exercise we'll say, okay, if this is the situation that you're facing, then let's write down all of the different factors that are going to influence the final outcome of this situation. So let's say someone is applying for a job. It's their dream job. They really, really want to get it. And then they find that they didn't. And then it's going, okay. And then they might start to self-blame a lot that, I'm not good enough or talented enough. So we might say, okay, apart from you and your skill set, what else is going to influence the decision that someone else is making in regards to who to hire? And so it might be things like the time frame in which they need to make a decision. There might be a policy about having a preference for someone who's already in the organization, the salary band that they're aiming for, prior contacts that they've already got, blah, 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 blah. So we're writing all of these things down, and then we develop a circle and we go through each of those, and their role, that individual, they're addressed last in regards to their level of responsibility or ownership, or the degree to which they've contributed to this. And then we'll go, okay, how much of this, if we were going to cut up this into a pie or a pizza, then how much do you think of this should be dedicated to this first thing that you identified, and then the next thing, and then the next thing, and then the next thing, so that by the end of it, often people realize, my role in this is relatively small compared to maybe how much responsibility I was putting on myself prior to this exercise. And then the last one that I would recommend for today is this positive outcomes log that I might ask a client to do, which might be, again, they're dealing with a lot of things, but I might say at the end of the day, I want you to write down 3 things that went well today. And then for each of those things to identify 3 positive qualities that this demonstrates about you. So let's say someone finishes a pitch for work or something. So you say, okay, well, that's a positive outcome that you finished this work responsibility. What does that demonstrate about you? Oh, it demonstrates that I'm organized, that I'm good at my written communication, and that I'm good at time management. And then I might say, okay, what else happened that day? Oh, well, I made dinner. And they might go, I made dinner, but it wasn't great. It's what I always make. They might sort of minimize their accomplishments a bit. And I'll say, no, let's go back to, well, what do those things show about you? And they'll say, well, okay, maybe I do quite enjoy cooking. It gives me a bit of an outlet where I'm not thinking about these other things. I am good with certain flavors. This is a dish that I've been cooking for a long time, and I know the kids really like it, so that was a pleasant experience. And it's a nice simple dish, so I only had 2 pots that needed to be cleaned, so then we could relax for the rest of the evening. So it's trying to help them shift away from, there might be some things that they're struggling with at the moment, but it's getting them to redirect themselves towards, well, what's the stuff that went well? And the more we practice that, then hopefully that starts to become more of the habitual, normal way that they might think about the situation.
Those are really useful advice. I particularly like what you said about, trying to highlight what you've accomplished within the day. Because sometimes, in situations like this, it's easy to be so negative. But I think if you try to highlight what you've done well, then it really makes you feel better. Now, Dr. Hilliar, I'm just interested to find out what do you think? What was the important thing you want the public to know about your clinical area or your research area?
My research area. Well, my research
or your clinical area.
Okay, so let's. In terms of research, there's a few different areas that I would be looking into, and I guess what I really enjoy is that more applied research around, there's this real world problem and how do we fix that. In regards to my clinical area, I guess I'd say, because I work with quite a wide range of clients. So I wouldn't say I have a sort of single clinical area, but I do tend to take on a more eclectic approach in how I work with clients. So I've been trained in a few different therapeutic approaches, but I tend not to take a singular approach and apply that. I'm often taking elements of a few different theories and principles and methodologies in regards to what I think is most relevant for that client. But I guess probably the main thing I'd want the public to know about, clinical work in general and my approach to it is that I see it as a very collaborative approach with my client when it comes to determining what therapy is going to look like for that person. Because I might be the expert in sort of psychological theory and practice, but you're the expert on you, and you're going to have much greater insight as to what is going to work for you. So I might have suggestions for my clients based on my initial assessment, and I might propose, here's an approach that we could try and see if that works for you. But I always tell my clients, look, if I'm ever suggesting something, they are just suggestions. You're totally within your rights to say, oh, I don't like the sound of that, or I don't quite understand why that's going to be helpful. Can you explain that a bit more? Or we try it for a couple of sessions and then they come back later and go, I'm not sure if this is really helping me. Or the flip side is them saying, yeah, I'm finding this really helpful. Can we do some more of this? Or that exercise that you got me to do before, that brought up this issue for me, and so I'd like for us to explore that a bit more. It's not me telling you this is what we're going to do. It's wanting to collaborate with you around, I want this to be useful and the most effective use of your time. So I do ask my clients to just be open with me around, is what I'm saying, does it make sense? Do you see value in what we're doing? Do you want to keep doing what we're doing, or do you want to try something different? Because there's never a singular way that you can go about approaching a particular issue that someone has. There's always multiple methods you can try, and then it's just a matter of seeing what works for you based on your personality and your learning style and your previous experiences and everything else that makes you you.
Mm-hmm. And is there a particular publication or a particular figure? It doesn't necessarily have to be in psychology, but someone or something which has the greatest influence on your work?
That's a good question. A particular individual. I mean, I'm very passionate about about psychology education and about making this information as accessible for people as possible, not just through outlets like your channel, which I think are great, but also even just the language that's used in explaining it, trying to not dumb down the concepts, but to present that in normal languages, not using too much technical jargon. So I really like those science educators, Bill Nye the Science Guy, those types of people where they still make this information, it's educational, it's scientific, it's accurate, but it's also really engaging work. Yeah, I think those are the people that really inspire me.
And Dr. Hilliar, when I was doing my research about your background, I noticed that you actually focus on, well, one of your focus is emotion-focused therapy. And now for those of us who are not familiar with that type of intervention, could you just explain to us what that involves?
Sure. So you'll see this referred to as either emotion-focused therapy. You might also see it referred to as emotionally focused therapy, it's EFT. And so this is a family of related approaches to psychotherapy, and it was originally devised for couples, emotion-focused couples therapy, but it was found to be very effective. And so people have broadened it out into therapies for individuals as well as in therapies for families. And so what EFT does is that it includes elements of experiential therapy, and experiential therapy is reenacting and re-experiencing a particular situation from the past or that's currently happening, takes elements of systemic therapy, and systemic therapy looks not just at you as an individual, but also in your relationships and the different interactions and interactional dynamics and patterns that people can have in how they relate to other people. So EFT takes experiential therapy, systemic therapy, and attachment theory. Are you familiar with attachment theory?
I need some refreshing.
Okay, so so attachment therapy. Attachment theory looks at what were those attachment style that you had to like your primary caregiver when you were younger. So that's John Bowlby and Mary Ainsworth's research, and that children around age 2, so Bowlby would say that there's a biological drive amongst us as infants to want to seek out connection with our primary caregiver. And then Mary Ainsworth devised the strange situation task as a way to assess for the type of attachment style that people have. But then that theory kind of got broadened out to, well, this is patterns of relationships that you observe amongst a infant and their primary caregiver, but that those patterns can continue into adulthood. So EFT is a very humanistic treatment approach, which looks at emotions are a central element to how we function. and is a good way to access and facilitate therapeutic change, so that our behaviors are often driven by an emotional need. And the role of the therapist is to help people identify what those emotional needs are, to feel more comfortable in their experiences of their own emotions, and to normalize that and to validate that. So sometimes we can feel like having certain emotions is a bad thing. I'm not allowed to be sad, for example, and going, no, all of these emotions serve a function. But at the same time, you also need to be able to manage your own emotions effectively. So you don't want to be really volatile and unpredictable in your emotional experiences, because that does make it more difficult for other people to engage and relate with you. So EFT is about really focusing on those emotional experiences. So it was a bit of a response, came out in the 80s in response to Western therapies really focused a lot on cognitive and behavioral CBT approaches, which have a huge role, and I use a lot of CBT. But as I said before, not every method is going to work for everybody. And for others, it might be focusing more on the emotions that are driving a certain behavior and helping people identify that, which is trickier for people. But that once you have a better understanding of what your own emotional needs are, and you formulate different skills to identify that and to communicate that to people more effectively, then you're going to find that your relationships, both within yourself and with other people, is going to get better.
Mm-hmm. And Dr. Hilliar, as an expert in mental health, as someone who's a practitioner and researcher, can you tell us some myths on mental health that you've come across?
Probably the two that I see most frequently is, number one, that mental health difficulties, mental disorders are a choice. Mm-hmm. That people, if only you just thought about things differently, then you'd be fine, or just get over it. And you go, well, that's very simplistic, and that no one would choose to be dealing with these sorts of difficulties. Now, there is some research around like secondary benefits, that certain behaviors might be reinforced by people around us. So if we're having troubles, and then does that get us extra attention from people, then that might be subtly reinforcing certain behaviors. But to be experiencing mental or emotional health difficulties, no one chooses to go through that. And at the current view is that we take on a very biopsychosocial model of mental health. So biology, you might be predisposed to experience certain difficulties given your own genes or your biology. So that's the whole nature side. And then you have your own psychological elements. So things like levels of resilience, your problem-solving skills, your cognitive skills, your temperament. All of these things might also either predispose you to respond to certain situations in one way versus the other way. And then you have the social element, in that it's the environment around you and the people around you as well are also going to have an influence. So anyone who's going through mental health difficulties, this is due to a combination of different factors coming together. So it's a far more complex issue that maybe a lot of people realize. And it's validating that. So it's exploring that so that it makes sense to the person as to why they might be going through these difficulties, but then equipping them with some skills around how to go about coping with that. And for some people that might involve like psychiatric interventions, like medications. Others, it might be purely psychological. Others, it's sort of social elements. So different methods are going to work for different people depending on what are the different factors that have come together for you to put you in this situation. So that'd be the first one. And the second one would be, there's the myth that people can't get better. So this person's always going to have these types of difficulties. But people can get better. I don't think you can be a psychologist without believing that people are capable of change to some degree. Now, the amount of change is going to vary according to various other factors that come into play. But people can learn skills and get to understand themselves better and the people around them better to cope with that and to recover from that. Now, different approaches are going to work for different people. And sometimes it is exploring that a bit. So I tell people, even if you've had a not so successful or pleasant interaction with someone from a mental health background, please don't take that as oh, this is never going to work for me. It might be, well, maybe that particular approach didn't work for you. But there's plenty of other approaches that we could explore.
Mm-hmm. And what, because I also understand that you also work with adolescents, so I'm just interested, what advice would you give to young people who are struggling with their mental health and well-being?
I mean, this is going to sound a bit cliched and obvious, but the advice I would give is to seek out professional help and advice, in that what they're going through is not their fault. It involves a complex interplay of different factors that have come together for them. And talking to other people about it, like friends and family members, your sports coach, religious advisors, all those people might be really good. But there's also a role for trained professionals to be assisting you with what's going on. People who aren't trained in this, your friends might be very well intentioned, but they might just be misinformed or limited in what they know. Now, I know for a lot of young people, the idea of seeing a psychologist is very intimidating or just really unappealing. But getting professional help doesn't mean you have to see a psychologist or a counselor face to face. If you're not comfortable with that, you don't have to do that. I think there's been a lot of work on trying to make this information as accessible to people as possible through a range of different channels. You might not want to see someone face to face, but seeing them online you might feel more comfortable with. Or there's phone-based services, or there's apps on your phone that will give you information, or there's YouTube channels like this one, or there's podcasts, or there's blogs from mental health organizations and universities and research bodies, and there's group-based sessions, and there's lots of websites. So getting information can be that first step. And for some people that might be sufficient for them, and for others they might decide they want to engage more actively with mental health services. Again, it's a matter of what works for you and what works for you right now, and that might change in a couple of months' time. So one exercise I get my university students to do is we compile a list of different online resources for that they think would be helpful to people to find credible sources of information, because that can be the risk. I don't want to tell people go and look online, because there's a lot of misinformation out there as well. So you do want to find credible sources. So if you like, I could share, they formulated this document. So I could share that with you, Dennis, if you'd like, and put that up.
And I always ask this, Dr. Hilliar, what's one thing about mental health and well-being that you think we should talk more about, because we're not hearing it more often?
This might be more of a logistical element, but I think we really need to talk more about the lack of mental health service coverage in health insurance plans. To be able to access mental health services is a luxury that a lot of people just can't afford at the moment. And I don't quite understand that, because there's some health insurance that doesn't cover mental health services at all. There's other ones where they'll only cover certain types of services, like inpatient facilities, but not outpatient. But then for that to happen, that means that the situation must have deteriorated to such a point that now they have no option but to go to a more high intensity inpatient service. Whereas if we had addressed this a few months ago in an outpatient facility, then this might never have deteriorated to this point and been as stressful and distressing for not just this individual, but their family as well. So if I had total control of everything, I would make it mandatory that all health insurance plans covered mental health services.
I hope you have control.
And it's very easy for me to say that, and I know there's cost implications to that, but it's, you know, it's somewhat unfair for me to tell people, oh, you should contact mental health professionals, when I know there's not enough of us out there to actually meet the demand that we know is there. You know, 1 in 5 people will experience some mental health difficulty at some point in their life, which is why, again, you know, we're trying to make this information available through other outlets so that you don't have to actually see a physical person if that's not possible for you. But we should also be recognizing, because this is such a highly frequent difficulty that people are facing, you know, that's like saying you can't see a dentist. It should be, for me, I would love it if it got to the point where having a check-in, like a 6-month check-in, like we do with our GPs, if you did that with a mental health professional, just to check in and see if anything's going on and direct you to appropriate services if it is, and, you know, to take a far more proactive, preventative approach rather than a more reactive crisis intervention approach, which often happens. I think our society would be much better off from a minimizing, you know, other costs that then come onto the system, because if someone's so unwell, then they can't be working. You know, it has a flow-on effect into other areas of the economy.
And Dr. Hilliar, can you recommend a psychology book?
So one book so I talked a bit about, like, in emotion-focused therapy, we talk about attachment theory. There's one very good book by Amir Levine and Rachel Heller. It's called Attached. Full title is Attached: The New Science of Adult Attachment and How It Can Help You Find and Keep Love. So it's a very long title.
Look for it, and then I'll put it on the description box. So for those who are interested to read about that book, they can grab it.
Great. Yeah, I think that's a really good one because so it does explain attachment theory, and it talks about, you know, it was born in terms of understanding child attachment styles, but that they saw that there's applications of that in terms of adult relationships. And the title suggests that it's about finding and keeping love. And I know that might put people off a bit, but it's not. I found that it talked about relationships in general. And I think it explains these concepts in really accessible language, and helps people identify, you know, what might be my own attachment style. Am I secure or am I insecure? And then when it comes to insecure, are you more anxious or are you more avoidant, or is it a combination of the two? And then how do you think that impacts on your relationships with other people, and identifying that in other people as well. So it helps to make sense of a lot of both helpful and unhelpful behaviors that people might be doing. So yeah, I think that's just it's a really nice book in the language that it uses, and it's available through like every online and physical bookstore, and you can get copies of it as an audio book as well.
Okay, brilliant. And Dr. Hilliar, what other interests do you have other than psychology? So this is becoming a bit more personal now.
So my de-stressing outlets would be theatre. So I love being on stage, and in the last few years I've been doing more production and directing, so the behind the scenes stuff. But I really love that process of creating something out of nothing, and exploring characters, and dance. So I did a lot of Latin dancing when I was still in Sydney.
Mhm.
And I met my husband here in Dubai, and we actually met through Argentinian tango events that they have here. So we do that a lot as a couple. Haven't been doing any tango for the last couple of months, given COVID-19. I keep telling him we should practice some moves with YouTube videos and everything.
I'll give you a tutorial.
But I really love those. It's using totally different parts of your brain and your body. So it's very different compared to the day-to-day work that I do. Although a lot of people tell me that being a psychologist must help me when it comes to acting and directing characters, because you are able to, I think it facilitates your ability to understand that character's perspectives and motivations and everything. But yeah, those would be my two main outlets. And they're a lot of fun, great way to meet different people as well.
Brilliant. And Dr. Hilliar, finally, where can we learn more about you?
There's biographies of all of the Heriot-Watt staff on the university's website. So if people Googled Kirin Hilliar, Heriot-Watt, then they would find my bio on the psychology page of the website. I also work at Open Minds Psychiatry, Neuroscience and Counselling Centre. So I'm up there on their website as well. Probably easiest thing is for your viewers to connect with me on LinkedIn. So if you search Dr. Kirin Hilliar, you'll find me there, and I'd be happy to connect with anyone who wants to have a chat.
Okay, thank you. Well, Dr. Hilliar, it's been an insightful conversation with you. Thank you for sharing your time and expertise. I look forward to hearing more about your work.
Thank you so much, Dennis.
Thank you.